Hello, my name is Dr. Derek Mahony. I'm a specialist orthodontist from Sydney, Australia, and today I'd like to discuss with you this new system which is called the MFS system. This was developed 21 years ago by Professor Jose Duran von Arx, and it was designed to be almost like a ready-made Frankel appliance. As we know, many children and adults suffer from soft tissue dysfunction, such as an abnormal swallow, such as a hyperactive lower lip, such as problems with nasal breathing. And what this system is designed to do is to quite simply allow a clinician to address those factors either before or even during orthodontic therapy. The benefits of this MFS system is, number one, there's no laboratory fee and you can fit this chairside. Number two, you can actually combine this system with fixed braces. I find that since I've been using this system, the amount of relapse I'm seeing in my orthodontic patients is a lot less. Basically, everything is outlined in this manual, but what I'll be doing today is showing you in segments how we use the different parts of the system, how we integrate certain sections, and overall give you a summary table so it will be easy for the clinician to be able to incorporate this into their everyday orthodontic practice. The requirements to use this kit are very minimal, and therefore there's not a large amount of expenditure for the clinician. You really need a digital caliper to measure the nose so we can fit the first nasal stimulator. And for some patients, I find using a little bit of Vaseline around the plug is more comfortable for the patient. For the other appliances, a simple ruler that's flexible that allows you to measure from molar to molar, or in the case of an open bite, from the terminal molar to the contact point of the incisors. And if we need to adjust these appliances, it's very similar to do that using some scissors. Many doctors do not want to invest in the entire myofunctional kit until they've had some experience in the system. The good thing about this system is that you can order individual sizes, and all you really need is to measure with a ruler or a caliper which size your patient will need. The material that the MFS appliances are made from is a latex-free polymer known as SEBS, and we have no problems with patients reacting adversely to this type of appliance. The type of patients that I use this appliance for are typically those who have problems with nasal respiration. Obviously, I always work with ear, nose and throat doctors if I have children that have large adenoids or tonsils, but the sort of patients this system is indicated for include patients who have nasal collapse, those who snore, your obligate mouth breathers, those who brucks, patients who have a reverse swallow or a tongue thrust. It's very good in patients who have gummy smiles while they're young because it helps to elongate the upper lip. I use it in open bite situations and also in deep bite situations. And the way I use the kit is sometimes one appliance on its own, or other times combining different sections of this kit, and that's what this series of videos will go through. So the first part of the myofunctional kit is the nasal stimulator, and I use this in patients who snore and also in patients who have nasal collapse. It works very much like a breathe right strip, but I find it's a lot more comfortable. What I would normally do is ask the patient to close their mouth and then inhale. And as they inhale, I can see if one part of the nasal valve collapses more than the other. And then it's very simple. We just get some digital calipers, and I'll show you this in a clinical setting. And we simply measure the inner aspect of the nose, the nasal valve, and I tend to then use one size smaller than the measurement to get the patient used to it. And normally after 2 weeks, we'll go to the larger size. With good wear, I find that patients get long-term success after about 9 months use of this appliance. And I warn patients that if it tends to fall out at night, they come back to my practice and I normally will give them a larger size. Conversely, if they get too much pain in fitting the appliance, then I will go to a smaller size. Occasionally when I'm inserting the appliance in the nose, if it's uncomfortable for the patient, I feel that I'm kind of scraping the nose, I tend to put a little bit of Vaseline on the end of the appliance to make it more comfortable. The appliance is designed so that we can keep this nasal bridge, but some patients find that irritating. So there's nothing wrong with getting some scissors and just modifying the appliance so that we have two separate plugs for the nostril, and sometimes patients find that more comfortable. So when I examine a patient for nasal collapse, I ask them to close their mouth and breathe through the nose, and normally you'll see one side of the nostril collapse. So what I'm doing is I'm measuring the other side to make sure it's the correct width, and you turn your head this way towards me, and you want to do it so that you're elongating, so you can see that's the right size. It's about 9.8, and if that's collapsed, you can see how much we can improve it. So if that's 9.8, I will then go to the kit, see the closest size, and that will be a size 0. I'll double check that size 0 by putting that there, and that's exactly right. We then use a little bit of Vaseline, and we place that Vaseline just on the tip to make it more comfortable for the patient. This one has already been cut, so we can see now as we fit this, it's quite comfortable for the patient. And then the one on the other side, also applying a little bit of Vaseline. Now, some patients will find that uncomfortable when it's not cut, and so I've cut it, but if they find it comfortable, it's easier to wear as one piece. So that's the nasal stimulator. We get them to use it for 1 to 2 hours a day to get used to it before they start using it at night, and then it's all night plus after dinner, and we see amazing changes normally within 9 months. With all of the myofunctional appliances, we'd like the patient to wear them for 1 to 2 hours during the day and then all night. That's how we get the most effective results. Obviously, patients will find it difficult to wear at night time for the first couple of days. So what I suggest to all my patients is that they try and wear these appliances for 1 to 2 hours during the day for a week until they're used to the appliance. And then when they're used to the appliance during the day, you'll find that it won't fall out of their nose or their mouth at nights. So the second appliance I use in this kit is the mouth obturator, and there's effectively 3 types of these, and I'll go through this. This is the permeable obturator, and it has the larger holes. We normally ask the patient to use that for 3 months. Then we get to the semi-permeable obturator, which has smaller holes, for another 3 months. And the last in the series is the impermeable obturator, which has no holes. Now, to measure the correct size for the obturators, we can do this in the mouth, or I prefer to take a study model. Being an orthodontist, we tend to have study models anyway, and we measure from the mesial of the upper first molar on the right side to the mesial of the upper first molar on the left side. And you just need a flexible ruler to do that. So if I show you an example of that, and from the mesial of the molar around to the mesial of the molar, that measurement is 94 millimeters. So we then go to our kit, and 94 millimeters equates to size number 3. What I say to patients is that if this, after 1 or 2 days of using it, during the day and at night, if it tends to fall out, we would need to go to a larger size. If on the other hand it's very painful, we'll tend to go to a smaller size. Sometimes the patients will find this irritates their lip or their cheek. Normally it tends to do that in this region, but no matter where it's irritating, it's very simple to adjust using these scissors. And you can see here I can make an adjustment on that side, and it's very comfortable, it's smooth, doesn't irritate. We prefer not to do this because ideally we want to stimulate the mouth, but if need be, if it means compliance and wear, we're quite happy to adjust that. Normally, to get good results, we are asking the patients to wear these appliances for 9 months. That 9 months is divided into 3 lots of 3 months, starting with the permeable operator for 3 months, then moving on to the semi-permeable operator for 3 months, and finishing in the impermeable operator for the final 3 months. We're going to measure now for this appliance from the mesial of the upper first molar to the mesial of the opposing molar. I like to do it on a model, but you can also do it in the mouth. So if we measure from the mesial here, across to the mesial on this side, then we have a look at that, and that's about 87 millimeters. So if that's 87 millimeters, I'm going to look and see which size closest fit, and here it'll be a permeable, that's the first one we use for 3 months, remember, and that is a P03. Now when you fit this, as you look at it, you'll be able to see the word MFS and DR. If MFS is upside down or DR is upside down, you're fitting it the wrong way. So if I'm looking at this now, I can see the MFS is the right way around. And if you look at it closely, you can see where the labial frenum is a much sharper groove than in the lower. So that's the way it'll be fitted. Right? And if we just ask the patient to fit this through here, you just put your lips together there. Good. Right, and that's as simple as that for fitting the obturator. And we ask the patient just to then put their lips together. We make sure there's a little bit of pressure there because we want that. Now remember, these obturators help with the lip seal, but at the same time I'm going to have the nasal stimulator to help improve the breathing. The next appliance I'd like to discuss in the multifunctional system is the lip stimulator. And the lip stimulator I use in patients who have been mouth breathers and or have lip incompetence. It's very good for children who have gummy smiles and I want to increase the length of the upper lip. Conversely, in older patients who are complaining of wrinkles or what we call vertical barcodes, it helps to improve the tonicity of the lip. Basically, the measurement is from the mesial of the upper first molar to the mesial of the upper first molar on the other side. And in this situation, it's 94 millimeters. So if we measure 94 millimeters, we're going to size 4. What I'd like to do to really stimulate the lips is after we get the measurement and we get the size, we go down one size. So in this situation, we measured the model, it was 94 millimeters, which gives us a size 4, but I'm actually going to be fitting a size 3. Again, with good wear, I'm recommending about 9 months for this to be very successful. During the first week, they would wear the appliance mainly after dinner, watching TV for a few hours to get used to it before they start sleeping with the appliance. The same rules applies as the other appliances, and that is if it tends to fall out, normally it means we need to put a larger size. Conversely, if it's very painful the patient to wear, I go to a smaller size. As far as adjustments, obviously you can adjust this anywhere, but I find most patients will complain about irritation in this region. So again, it's very simple to get some scissors and just to adjust in that region. So now I'm going to be fitting the lip stimulator, and the first thing I do is I measure the distance from the mesial of the upper left first molar to the mesial of the upper right first molar. Now we've already measured this in the last footage, it's the same measurement, but I'll show you again. From the mesial over to the mesial, it's a flexible ruler, and we look at that measurement and we see what will be the closest fit. The measurement's 87, 88, and therefore we're going for our lip stimulator number 3. Again, when you pick this out of the packet, you've got to make sure that you can read MFS the right way around. So that's upside down at the moment. I turn it around and I can see the MFS. It can be fitted this way or that way, that doesn't matter, but this would be incorrect. So if you look at it fitting the right way, you can see the groove for the labial frenum is much more acute than in the lower. So we're going to fit this appliance, and when you fit this appliance, remember, you should see the patient's lip musculature being active because it is a stimulator. So again, you can feel there and the pressure, and this is the appliance where after 3 months we'll move to the larger size to give even more lip stimulation, and on average it's taking about 9 months to see an appreciable change. Okay. The next in the series of appliances in the multifunctional system is the muscle relaxant. This is one of the first appliances that I can combine with one of these bite plates. Now, the indications for this appliance are mainly for patients who have an overclosed vertical dimension, the classical brachycephalic type of patients. And for those patients, the measurement to the correct size is from the distal of the first molar to the distal of the first molar. If, however, I'm using it purely for bruxism, I would use one size smaller than that measurement, and I'll show you that calculation in a moment. So this appliance can be used on its own for what it's designed for, a muscle relaxant, or you can combine it with a bite plate. If I'm combining it with a bite plate, I'm going one size smaller than that distal to distal measurement. In this appliance, we're measuring from the distal of the first molar to the distal of the opposing first molar. In this particular example, that is 115 millimeters, so I will go for a size 4. Now, if I'm using this specifically for a patient who's a brachycephalic overclosed vertical dimension and I'm not putting a bite plate, that's the size I'll use. If, however, I decide to add the bite plate, I will go for a size 3 in that appliance. With good wear, I'm recommending 9 months for this to show positive changes. And again, if there's any irritation, such as rubbing against the lip or cheek, I'm able to adjust this with a pair of scissors in the area of irritation. And the real benefit of this is one of the few, if only, appliance on the market that I can combine with fixed braces in a bruxer. We've all had patients who keep breaking brackets because they're bruxing during the night, and it's very hard for us to then make them a bite plate because we're still moving the teeth. This is very easy to combine with braces, and that's why I use it a lot in those patients who brux or grind their teeth at night. By discluding those back molars, I'm also noting much quicker tooth movement, so that's an added bonus of using this appliance. If you look at the way this appliance is designed, when the patient wears it, they are discluding their molars. And in a deep bite brachycephalic patient, I want an anterior bite turbo, which is what this is doing, but I also want molar eruption. So by the patient wearing this, the molars are free to erupt, and as a result, I'm opening my deep bites a lot more effectively than I would with the traditional methods such as class 2 elastics, etc. So this is appliance number 5, and the appliance number 5 is a muscle relaxant, but I'm combining the muscle relaxant with the bite plate. Remember, this is the first of the appliances that we are going to measure from the distal of the first molar. Up to now we've been measuring from the mesial to first molar. So if we measure here, distal of upper first molar, bring that around to distal of the upper right molar, and we look at that measurement, it's about 105 millimeters. So then we'll go to our kit and we'll find the closest fit will be the MR3. If we have that as the MR3 and I'm using it purely as a muscle relaxant, that will fit. If I'm going to add the bite plate, I'm going to go down to an MR2 and then fit the equivalent of these, which will be the BP2. So how do we fit the bite plate to the muscle relaxant? Again, look at this, make sure you can read the writing. That will be upside down. This is the correct way around because I can see MFS. And we get our bite tab. And you can see with our bite tab, we fit the lower component and then snap fit the upper like that, like this. And remember, I'll measure from the distal of the first molar to the distal of the first molar. Whatever size that gives me, in this case it's an MR3, is if I'm using it without the bite tab. When I put the bite tab, I'm going to go to an MR2 and a BP2 to give me better retention. And this is very good for brachiofacial patients. You can see as they bite on that, it's like a bite turbo. Excludes the molars, so it really helps to extrude molars, intrude incisors, which is what we need to reduce deep bites, and also that will help our bruxers. And what's great is I can use this with fixed braces at any stage of the therapy. So let's fit that. We actually just right in on that. Great. Okay. So for a low angle individual that's brachycephalic, as they clench, you can see they're putting force on the anterior part of that tab where they're allowing the molars to erupt. So that is the muscle relaxant combined with the bite plate for low angle brachycephalic patients with a deep overbite. Now, the last of the appliances in the multifunction system kit is the open bite appliance. And as the name would indicate, I use this appliance for any open bite. I use it in a situation where I have a lateral open bite or an anterior open bite. It's very good for tongue thrusters because you can see the tongue can't go into its abnormal position the way it's designed. Now, the classical patient will be a long face individual, what we call dolichofacial. The last appliance I discussed for deep bites for bruxism allowed the molars to erupt. This appliance is the opposite. It allows the incisors to erupt freely without the action of the tongue thrust, but it prohibits the molars from erupting. So as a result, it's very good at closing down open bites. I see many clinicians try and close open bites heroically using anterior elastics, and we find that the stability of open bite closure just with anterior elastics is not as effective as intrusion of the molar. And there's not many appliances on the market that you can combine with fixed braces. With this one, you can. Now, the measurement of this is slightly different. Obviously, we are measuring on the lower model, and we measure from the terminal molar, whatever that may be. It may be a first molar, it may be a second molar, it may be a wisdom tooth. So from the distal of the terminal molar to the contact point of the lower incisors will determine the size that we need. In this particular model, I'm measuring 46 millimeters. So I go to my table, I look at 46 millimeters, and it becomes a size 4. Now, in the past, we could measure for these appliances in the mouth. Here, I really would like the clinician to take a model because it's more accurate. And secondly, you can try this appliance on the model to see if it's fitting well, and also to make sure that it is covering all the molars. Occasionally, I'll have a case where a patient is missing a molar on one side. If that's the situation, I would use a scalpel and I would trim this appliance in that section so that we don't get any flexing. It's very important that we limit the posterior teeth from erupting. The other common problem I find in this appliance with patients is it tends to rub on the lingual frenum. And again, if that's the case, we can use a scalpel to adjust that area. And after using the scalpel here or there, I tend to trim it with a burr to make it comfortable. Like the other appliances, I ask the patient to get used to this by wearing it for 1 to 2 hours during the day before they start wearing it at night. But like all these appliances, the best results are obtained by wearing it all night and also 1 or 2 hours after dinner. On average, with good compliance, you'll see changes in the open bite within 9 months of using this appliance. So to summarize, this is one of the appliances where the measurement is different. The measurement is on the lower model. In this appliance, I'd like you to actually take a lower model rather than measuring the mouth. Trimming of this is preferably done with a scalpel because it's a much thicker material. And after you adjust with the scalpel, you just trim with a burr. So this appliance indications are for open bite, long face individuals. You can use it with braces, and the goal is to allow the incisors to erupt while you inhibit the molars from erupting. So I'd now like to summarize how you can get the most out of your multifunction system kit. And I've put together a little summary table here, which is what we call a work protocol. And if I go through the different sections with you, on the left side are all the indications such as snoring, bruxism, etc. And on the right side, I'm showing what appliance to use. Now, introducing a lingual button. When I bond lingual buttons, it's normally to stop the tongue from going to its lazy position. I used to put lingual buttons behind the upper incisors, and what I find is the tongue avoids that but then goes in the wrong position. So now I tend to put my lingual buttons behind the lower incisor teeth. So that's really the only new appliance I'm introducing in this system. Now, if we look at column 1, it's just to remind clinicians that they need to check the patient's adenoids, tonsils and lingual frenum. And if the adenoids are large or the tonsils are large or the lingual frenum is encroached upon, then you would need to organise to have surgery done on those patients. The first section then, if we go back to our nasal stimulators, our nasal stimulators are used for patients who snore, and I find they're very effective in those patients. Much like a breathe right strip would work. The other indication is for long face individuals and those who have nasal collapse. So if a patient is a mouth breather, snores at night, has a long face, when you ask them to close their mouth, which is not usual for them, and then try and breathe through their nose, if you see one off the alar basis collapse, that's another indication for the nasal stimulator. The next along in the table is our oburators, and remember in our oburators they are 3 styles. You start for the first 3 months with the permeable oburator, then you go to the semi-permeable, and then you end in the impermeable. And what are the indications for those? Again, patients who are dolichofacial and patients who are mouth breathers with lip incompetence. What we're trying to do with these appliances is strengthen the lip seal. As Frankel said, if you want to minimize relapse and if you want to maximize tooth movement, you need to teach a child to breathe through the nose with the lips together. So for the majority of my patients, I'm actually using appliance 1 and 2 at the same time. I'm using my nasal stimulator to help improve nasal breathing, and I'm using my oburator to improve lip seal and prevent tongue thrust. The next in the appliances will then be the lip stimulator, and the lip stimulator we use in situations where we've had a enlarged lingual frenum and now we want to change the position of the tongue. We also use it in situations where we have lip incompetence and reverse swallow or tongue thrust or anything atypical in the swallowing pattern. And in this appliance, again, with good compliance, we're expecting changes within 9 months, like all the others. We're moving along the list now. You can see the lingual button, and this is a bondable button. This lingual button I will use in situations where I've had a previous enlarged lingual frenum, and as a result I need to change tongue posture. Also in those who have a tongue thrust, and the tongue thrust normally goes hand in hand with open bites, whether they are an anterior open bite or a lateral open bite, the tongue will be in a faulty position. So to change that faulty position, we're giving the tongue some guidance of where it should not be sitting. Our next appliance is our open bite appliance. And again, if you look at our table, our open bite appliance is used in patients who have long faces or dolichofacial individuals. They're also used in patients who would have an open bite, whether that's an anterior open bite or a lateral open bite. And these patients commonly have a tongue thrust. So remember, the design of this appliance is very good because it prevents molars from erupting, and it has a seal so that the tongue cannot go forward. The next appliance we are using is a muscle relaxant, and the muscle relaxant is used in the opposite individual. We've just talked about the long-faced individual with weak musculature where we don't want molars to erupt because they have an open bite. Now we're talking about the opposite individual. This is the patient that has the deep bite, that's a bruxa, that's brachycephalic, that has these big masseters, that may have mandibular tori. For this individual, we want to relax those muscles, and we use this, and we use this on its own. Remember, that's going to be the larger size, or we combine it with our bite plate, and that's going to be the size that's one size smaller than what we measure. So the indications for using the bite plate are for patients who brux, for brachyfacial individuals, and those that have a deep overbite. And that is not really able to be used on its own. It's used in conjunction with our muscle relaxant. And that summarizes the MFS protocol.